there, Miss
Hello.
Yiping. I'm your nurse today. My name is Brogan, and I understand you have some questions about your new diagnosis, chronic kidney disease. I'll be getting you ready for this, and we can talk all about it. What questions do you have for me first, and how are you feeling?
Honestly, I'm so overwhelmed because I just found out I have a end stage about the kidney disease, and now I am supposed to change my entire life. I don't really know what is to expect and what does this even mean.
I completely understand. It's a lot to take in. Let's take it step by step. First, know that you are not alone in this. More than 7 in 10 Americans have chronic kidney disease, CKD. Your kidneys are not functioning normally anymore. I know that sounds scary, but we will start hemodialysis, and I will answer every question you have along the way.
Yes, please, that would be help.
First, I'm sure you're wondering what's happening in your body. Your kidneys are responsible for filtering waste and excess fluids from your blood. But with chronic kidney disease, your kidneys lose that function over time. In the end stage, they can't filter well enough to keep your body in balance. Kidneys need to filter out proteins, sugars, and other waste products through many processes. Removing these normally prevent harmful buildup in the body.
You mentioned about the hemodialysis. What is that?
Hemodialysis is a treatment that we use that pretty much replaces what your kidneys used to do. It's a special machine to filter your blood. It removes those waste products, extra fluids, and helps keep important things like potassium and sodium at safe levels. This keeps everything in balance. With this, you do get a perm catheter placed as well.
That makes sense. I am unsure what is the perm catheter is. Could you explain this more, please?
Absolutely. This is a tube that gets put into the neck or upper chest. It helps us access the veins and the bloodstream for hemodialysis. We use the perm cath for long-term dialysis, and it reduces the risk for infection.
Okay, that does make sense for me right now. And how often will I have to do the hemodialysis?
Yeah, typically you'll come into the hospital or a dialysis center about 3 times a week. Each session lasts 3 to 4 hours. During this, you can bring a book or something to distract you as well. We do try to make you very comfortable, as it does take a while.
That sounds good. Are there any risks doing this, or are there any complications, something?
I won't lie to you. Like any procedure, there are risks. Infection is a big one. We make efforts to keep everything clean and infection-free in our dialysis unit. Other complications might include low blood pressure during dialysis, cramps, headaches, or feeling very tired afterward. But we'll monitor you closely and keep you very safe.
Okay, that makes sense for me too. And do I need to change what I eat?
We highly recommend that you follow a renal diet. This means limiting sodium, potassium such as bananas, and phosphorus, fast foods, and soda. Chronic kidney disease can cause high levels of all of these. We always want to try to keep everything in balance. Another thing I want you to do is watch your fluid intake. Please make sure you're getting enough water. Another thing we want to maintain in your diet is protein. Lowering the amount can help the kidney function better.
Okay.
We'll have a dietitian work with you to create a meal plan that fits your needs.
Okay, but changing my diet gonna be very, very hard. But I am glad you're there to help me. And will I able to do like the normal activities, something?
Many patients continue daily activities, work, and their hobbies. You'll just need to plan around your dialysis schedule, and I want you to stay active, but rest when it's needed and avoid contact sports. Always listen to your body. Now, if you experience things like fever, chills, redness, or drainage at your catheter site, please call us and we can walk you through the next steps. If you have difficulty breathing, extreme fatigue, or confusion, call us right away or go to the ER with these symptoms. Other symptoms I want you to watch for are weight gain, headaches, making little or no urine, lower back pain, muscle cramps, nausea, and vomiting. If you have any shortness of breath or edema.
What is edema?
This is if you see any swelling in your arms or your legs. Always keep in contact with us if you feel something's not right.
Okay, I understand this too. Will I need to do some new medications I have?
Yes, your healthcare provider has started you on a diuretic. We want you to take your weight daily around the same time and with the same amount of clothing on. Keeping a weight diary will help you keep track of this. You also have diabetes, so we will keep you on your regular insulin medications. We will likely get you on an anticoagulant to lessen the risk of blood clots. With this, we want you to use bleeding precautions, such as soft bristle toothbrush, no picking at scabs, and like I mentioned before, no contact sports. Another medication we will start you on is erythropoietin stimulating agents. These will help your body produce more red blood cells and keep you from being anemic, low iron. Lastly, we will start you on a phosphate binder. These will help remove phosphates and so it does not lead to the calcification of blood vessels.
That's a lot about the medication you need to learn about.
It is, I understand. We can make sure to have a pharmacist come talk with you in detail about the plan to make sure you feel comfortable before going home. The last few things I want to leave you with is to watch for those signs and symptoms we talked about. Rest often, keep your fluids up, do not miss appointments, and keep up with your medications. This will help us to help you. I hope we covered all of your current questions, and if you have any more, to reach out to me.
Yeah, thank you so much, Nurse Brogan. And I feel more informed and a little just like the anxiety right now.
You're very welcome. You're not alone in this, and we'll support you every step of the way. We'll make sure you feel confident managing your health and knowing when to reach out.
Okay, thank you.
Thank you.